We respectfully acknowledge that the Windsor Regional Hospital occupies the traditional, ancestral, and contemporary lands of the Niswi, Ishkwiden, Anishinaabeg, the Three Fires Confederacy, Ojibwe, we respectfully acknowledge that the Windsor Regional Hospital occupies the traditional, land and the surrounding waters contemporary for sustaining us, and we are committed to protecting and restoring these lands and waters from environmental degradation.
Good evening, everyone, and welcome to the October Windsor Regional Hospital Open Board Meeting. I'm just going to open with a quick note. I just wanted to say a quick thank you to Patty France, St. Clair College, and their Alumni Association for a fantastic event a couple of weeks ago. They are tremendous supporters of the Windsor Regional Hospital and the new acute care hospital planning project, as well as fundraising for it. So just want to say a big thank you to them for the $1.1 million donation from both the school and the Alumni Association. I don't see Patty on, but thank you again to her and all of her staff for putting that on. It was really a tremendous event, so thank you. First up today, we have a absolutely fantastic presentation being given by Sarah Mushtaq. Sorry I butchered your name. It will be regarding equity, inclusion, diversity, and anti-racism, also known as EIDAR. So Sarah, take it away. Thank you for being here.
Thank you so much, Anthony. I'm excited to share. I'm just going to share my screen, assuming that's good. Thumbs up. Okay. All right. So as Anthony said, I am the director for equity, inclusion, and anti-racism here at the hospital, also known as EIDAR. It's a little bit of a mouthful, so that's our acronym for it. This announcement went out in August, and I started in this role in August 22nd. So it's been a little over a month. I keep saying that to everyone and reminding myself of that too. I just want to share today about what this role entails, and then kind of what we're planning for the next little while. So in this role, the last couple of years, I think the pandemic has really highlighted for us society across the board, outside of healthcare as well. But from the healthcare perspective with the pandemic, we saw how much those inequities were really highlighted by the pandemic, and how those disparities really were, on display for different communities. So when we look at the hospital and we look at what we're doing from a healthcare perspective, we wanted to make sure that we were looking at equity in a more strategic way, and ensuring that this was included in every area of our practice, across all our programs and policies, so that we're supporting our staff with the tools and resources they have so that they can provide the best care possible for our patients and their families. So it's looking at our structures, it's looking at our corporate committees, and it's, making sure that we are as inclusive and culturally safe as possible, no matter what service we're providing for any person who comes through our doors. So this role is kind of modeled under the Ontario Health EIDAR framework. So Ontario Health has done some work in the equity space, and really highlighted what they're kind of looking at it from like a provincial level, so very high bird's eye view. And we've taken some of those elements and built that into this role, right? So we're looking at, how we can ensure that our corporate planning or strategic planning, reflects equity when we're looking at our policies, how that affects how equity is reflected in our policies, how we're engaging with different communities, how we're making sure our staff feel, supported and safe in their workplace, and so on. So this I know is like probably a little bit hard to read right now, but it is on Ontario Health's website, so you can go there to read it in more detail if you so wish. I also wanted to share this, which was shared by the province with their system recovery goals. So, I alluded to the pandemic and, the disparities that were, highlighted that we knew existed before, but were highlighted over the last 2.5 years. And the province has, also put in plans, both in conjunction with their EIDAR framework and other areas to target certain communities and make sure that they have the resources that they need. So, there's cancer screening. They're looking at targeted cancer screening for Black populations. They're looking at mental health and addictions and supporting Black populations. They're looking at, access to surgeries, procedures, diagnostic imaging, and other areas. So through this role, we hope to support these departments, right? We want to make sure people aren't necessarily working in silos. We can work together across the hospital and different programs, and make sure that we're, sharing and helping and supporting each other in actioning some of these goals. So over the last little month, this is kind of what we identified as some of the action plan or areas in the action plan. We want to support, obviously, equity, diversity, and inclusion throughout the hospital in a very, strategic way. Build capacity to promote diversity awareness and knowledge, right? Like making sure that we have, cultural safety training and resources for staff, as they're providing care to patients. Doing our best to reduce systemic biases and barriers to an inclusive environment in the workplace. So, ensuring that's a culturally safe place for any person to work in our organization. Enable the recruitment and retention of a highly skilled, engaged, and diverse workforce. So same thing, if we are able to create a culture that any person from any background feels safe, that also means that we'll see those sorts of individuals in positions, they'll stay with us. They'll go into leadership in our organization and, make our organization better for that. And then, just work on implementing this plan. So over the last little while, which is a little over a month, we've done a lot of work in engaging with our various departments and leadership. So what I've done is, meeting with different departments, going to the units, getting to know them and talking to them about their needs when it comes to, equity and diversity and inclusion. So talking to them about, education that might be needed, resources, like how can we better leverage our language line, use policy, so use of a preferred name, collecting data around race and ethnicity, and that sorts of things. So I'm trying to compile that sort of information right now, and then build that into an action plan so that we can build it into our practices, our everyday practices. Some of this work had already, there's a lot of work that had already been started. I would be remiss not to mention Aruna Kuchik, who was the Human Rights Commissioner, and she retired in the spring, so just a few months ago, earlier this year, and did a lot of work in this space before this position was created. So we're working with off of the foundation that a lot of others have created. And one of those things is related to education series, right? So one of the great things is, leadership, managers, directors have identified areas that, education would be helpful and training sessions would be helpful. So Anthony, we had been chatting before the meeting had started about a series that we did for some of the leadership team and the new hospital planning team on Indigenous communities in the Erie St. Clair region. And there will be a follow-up session about relationship engagement with Alethea Kiwiash, who's the director of the Indigenous Cancer Care Unit at Ontario Health. And then we also have a planned session later this month about anti-racism, anti-Black racism, sorry, I should say, in healthcare. So lessons from that and what we can do to further improve. And of course, we just passed Orange Shirt Day and Truth and Reconciliation Day, which was this past Friday, September 30th. And so David and a few members from the team, we were able to attend a community event for it And we also, with the support of our public affairs department, were able to obtain some orange t-shirts, and it was really lovely walking through the halls on Friday, seeing so many of our staff wearing orange in support of Orange Shirt Day. So, as we build these connections with staff, we also want to build an engagement with community groups as well. So, just reaching out to different community groups across the community, getting their input on, healthcare equity related concerns, and remembering this mantra at the bottom that comes from disability groups that, nothing about us without us. So always remembering that whenever you do engagement with different groups, whether they are underrepresented or marginalized, that there's always conversation with those groups before there are decisions made about them. So this is the proposed timeline, and I'm going to say this with a grain of salt, a very big grain of salt here. So this is what we're kind of looking at for the next few years. We'd like to see over the next year an action plan develop so that it can kind of, map out what the subsequent years will look like. And the first year will be a lot of like setting up the foundation, right? So setting up our corporate, our governance structure for input by staff through a diversity committee. We have a diversity committee before, but just improving its structure, improving our policies and research, and exploring a process for a diversity survey. So that would be basically a census of understanding what our staff look like and what backgrounds they're from. And then so you can see for year 2 and 3, there's a lot of operationalizing of that, of, implementing that, looking at training and developing those sorts of trainings related to equity. And then, implementing a survey, hopefully by that point. And then, reviewing the TRC recommendations as well, and making sure that we commit to them in engagement with Indigenous communities. So this is a quote. So in the research, while we were going over this is a quote from Sick Kids and their action plan. So I just left this in here because I had put this in my pitch, and I think it really nicely summarizes what we're looking to do, is that, by this work, we ensure that no matter who comes through our doors, whether it's someone who works here, who's staff, or if it's a patient, family member, caregiver, that they're recognized, they're respected, they're valued, and they're validated, that everyone is welcome here. So hoping through this work, we can, we already do a lot of great work. There's a lot of great, I hear the stories of, staff on the units and what they do to make sure, patients receive care in a culturally safe way. And, this is just an opportunity to build on that great work that we're doing and making sure that it's in every single department. So I will leave it at that. And if there's any questions or comments, I can take that.
Thank you, Sarah. Does anybody have any questions for Sarah? Linda.
Just a comment. I was able to take part on the education session on earlier in the week. And I just gotta commend you, Sarah, in terms of, it had a sticky factor, in the sense that later on in the day, I was still reflecting on the video. And I think there would have been a time where the questions that were asked wouldn't have been asked, nor would there have been a responsiveness to answer. And what I really saw, that there was a humility and an openness and a trust that went both ways. And it wasn't at all shame or blame, but it was genuine listening in terms of this story. Like I said, it stuck with me for quite a while. And there's a term, patient accompaniment, patient not as in someone receiving care, but and it's been described as removing our sandals before the ground of the other. And I think what you shared with us on Tuesday was just a wonderful example, and kudos to you.
Thank you, Linda. That's very kind of you. And I'm glad that that's the experience you got from that. That's definitely our intention of we want to bring people together through this, not apart. So I'm glad you had that experience.
Any other questions or comments for Sarah? Sarah, I just had one comment or question really is, as a board, what can we do to help spur this on and really help lead the charge?
I mean, exactly this today. So, this sort of engagement and, support, I think is really important, right? So showing participation in these series, involvement in that, and just, that this will be supported in every way, I think is really important. And that sort of leadership and direction goes a long way. So thank you for that.
Well, again, we appreciate your time today. Great presentation and looking forward to everything that's going to come out of your department in the next few years. So thank you very much. Appreciate it.
Thank you.
All right. So we will be moving on to our regular agenda items now. Do we have any declarations of conflict of interest? Seeing none, thank you. Can I get a motion to approve the previous minutes? We have Paul LaChance, seconded by Lori Freeman. Thank you, Lori. Questions or comments with regards to those minutes? Seeing none, all in favor? Wonderful, thank you. First up, we have the report of the CEO, President and CEO, David Mouche. David.
Thank you, Mr. Chair. For all of you, the report's in front of you and it'll be posted on our internet site. Needless to say, in the report, we talk about what we had with respect to a very active month here at the hospital, and then for us to be preparing for the fall and winter pressures in front of us. And Karen Riddell is going to be speaking about influenza vaccines and also COVID vaccines, and then talking about needing to ensure not only our staff, but our community participates in both to try to make the fall and winter pressures a little less difficult in front of us. But at the same time, we were very pleased to have the Deputy Premier and Minister of Health, Minister Jones, attend Essex Windsor and recognize various programs that were started by our Ontario Health Team, our Windsor Essex Ontario Health Team partners with the Ministry of Health and Ontario government support. It was great to have Minister Jones here to be able to celebrate another proactive step in the Windsor Essex new acute care hospital process in announcing the selection of Stantec as the PDC, or Progressive Design and Conformance Consultant. At the event and out in the community, many people have asked me about the possible risks to our new hospital project moving forward. And also, I've been asked, whatever happened to the legal costs? Camp, who was opposing the process, was ordered by the 2 court decisions to pay to the hospital in the city of Windsor. Whatever happened to that? So, as clearly stated by Minister Jones, Premier Ford sent along a message with her. His message was to emphasize to Windsor Essex, the province is not going to delay this project. However, unfortunately, Windsor Essex can delay it. So you might want to ask, okay, how can this happen? How can it possibly be delayed? And you don't have to look far. The current municipal elections across Windsor Essex present a risk, meaning there are some running for council and mayor that have publicly shown their support for camp verbally and or in donations to their various appeals to the zoning process, even though they were unsuccessful at every step. In fact, you might recall the last court decision, Justice Corbett, in describing what camp's review really was, stated, and I quote from his decision, "Thus, the proposed review is, on its face, only useful as a collateral attack on the final decision. That is an abuse of the process." Justice Corbett concluded in his decision, there comes a time when litigation cause has been lost. When a litigation cause has been lost, it is over. However, in printed media article of May 22nd, after Justice Corbett's decision stating it's over, I quote from the article, according to Camp, while its most recent motion for a time extension was unsuccessful, the group and its supporters have committed to pursuing other options. Then legal counsel for Camp commented on Camp future plans, and I quote from the article, past councils can't bind future councils. There's going to be clearly be an opportunity for some more discussion. Well, that time's before us, Windsor Essex, to ensure that the next councils, and that's both in Windsor and the county, supports the decisions of the last two councils on the Windsor Essex new acute care hospital. That's the risk before us. If you want to go, it's public information. Go to the Camp website. You can scroll through the names of donors, and you're going to see some current candidates for council in both the city and the county. And also remember those who previously publicly announced or voted that they were opposing the hospital location and or the 10% levy. Some have changed their opinion, but please ensure that change does not attach conditions. Now, in both court decisions, Camp was ordered by court to pay the City of Windsor and Windsor Regional Hospital a combined amount of $55,750 plus interest. To date, Camp still owes Windsor Regional Hospital $6,942 plus interest, and I confirm they still owe the City of Windsor $23,568 plus interest. However, as stated, many Camp supporters are running for council and or mayor, some claiming they're fiscally responsible. If they're truly fiscally responsible, they should first be doing everything in their power to ensure that court-ordered payments are paid to taxpayer-funded entities like the hospital and the City of Windsor. As stated, the time is before us, Windsor Essex, to ensure the next councils support the decision of the last two councils on the Windsor Essex new acute care hospital, and especially the ongoing 10% levy. I'm hopeful I have answered the questions that I have been asked by the community regarding what the risk is before us. So, Mr. Chair, that's my report.
Thanks, David. Do we have any questions or comments for David at this point in time? David, I just had one quick question. Do we know what are legal costs associated with that? Those challenges were?
Oh, hundreds of thousands of dollars. It's not only legal, but it was the planning and getting prepared. We have to remember there was, the initial presentation to the City of Windsor Council, which is expected, the appeal to LPAT, then there was a first appeal to the court, and then there was another appeal to the court. And that sequencing cost not only ourselves, but the City of Windsor hundreds of thousands of dollars.
And just so I'm clear, the costs associated, what the funds that were charged by the courts were just a minuscule amount of, or a small portion of what we actually paid in legal fees, correct?
Correct, a very small portion, but it's typical. But the courts, if you read the decisions, went out of their way to indicate that costs should be paid because of the lack of merit in the proceedings of the appeals.
All right, thank you. All right, next up, we'll have the C&E report with Ms. Karen Riddell.
Thank you, Mr. Chair. I'll just wait for my friend Matt to bring up my presentation for me. And good evening, everyone. Thanks, Matt. So you can go on to the first slide there. So what I'm going to just review this evening is just expanding on what we talked about in September a bit more. So we had talked in September about what we are thinking the projections are going to be for this fall and winter in relation to influenza, COVID, and also RSV. So I'm going to talk a bit about those projections, why we think that, and what will be important for us to do to mitigate the risks associated with that. So what we saw in September was the Australia experience. So what they experienced in this season, and we often watch them for what we can expect as it moves around the globe, was an earlier season onset, a higher number of cases than the last 5 years, and an increased demand for hospital beds. So when you're looking at the two graphs on the side, just look at the red line. That was 2022. So you can see in comparison the numbers of cases to the dotted lines over the previous years. Next slide, please, Matt. So I want to talk a bit about the influence and impact of influenza. So we know that in 2021, we only had less than 30 lab confirmed cases of influenza in Canada. Now that's a US chart over on the side there, but it's very reflective of what we saw. So you can see in March of 2020, the influenza season abruptly stopped. So why did that happen? Well, we know the public health measures were put in place, such as physical distancing, hand washing, masking. All of those were implemented to control for COVID-19. But what they also had an impact on was influenza spread, because they're spread by similar mechanisms. So why are we expecting an increase during this season? Well, we know that those measures have been lifted and certainly loosened. So annually, influenza results in about 12,000 influenza-related hospitalizations Canada-wide, 3,500 deaths. And influenza and pneumonia are ranked among the top leading causes of death in the Canadian population. The numbers will vary, obviously, depending upon the severity of the influenza season. And if we're anything like Australia, we are expecting to have a heavy influenza season this year. So symptoms of influenza: fever, chills, cough, runny nose, stuffy nose, sore throat, headache, muscle weakness, and fatigue. And we do know that cough and fatigue can last for weeks. Complications, like I mentioned, include pneumonia and other secondary bacterial infections. And those more serious complications can also necessitate hospitalization and result in death. Important to recall as well that influenza can also be asymptomatic, but still be transmitted to others. And the contagious period can be up to 5 days. Next slide, please, Matt. So let's talk about how we can prevent influenza. So we know influenza is a serious viral respiratory illness, and it's spread by droplets from breathing, coughing, sneezing, and by direct contact with contaminated surfaces, followed by touching your mouth, nose, or other mucous membranes without cleaning your hands. So in addition to the public health measures that we're very familiar with during COVID, such as physical distancing, hand washing, masking, the influenza vaccine is the best defense against getting and spreading the influenza virus. The important thing to remember this season too is that we do have a potential for continued COVID-19 circulation this fall and winter. So it's essential to really prevent morbidity and mortality or illness and death related to influenza on top of COVID-19, so those co-infections. For those that are not aware, Ontario has a universal influenza immunization program, and it offers free influenza vaccine every year for those 6 months and older. And those influenza vaccines will soon be available in Windsor, Essex, at your local primary care provider. The public health unit will assist in distribution, pharmacies, and various other settings. So check in on wechew.org for updates for their arrival and locations for vaccination, but we're expecting those in the next week or two locally. Next slide, please, Matt. So who should get the vaccine? So it's really recommended for everyone 6 months of age and older that does not have contraindications. Those at the highest risk of severe COVID-19 related illness, or those capable of transmitting influenza to those that are at the highest risk of severe and critical illness related to COVID-19, and to avoid co-infection of influenza and COVID-19 are also recommended. So the highest risk for complications and hospitalizations are those that are pregnant, residents of nursing homes, chronic care facilities, those aged 65 and over, children aged 6 months to 4 years, our Indigenous peoples, 6 months and over with cardiac, pulmonary, diabetes, metabolic disease, cancer, immune system compromised, renal disease, anemia, and other hemoglobinopathies, neurologic and neurodevelopment conditions, BMI greater than or equal to 40, 6 months to 18 years that have been on long-term ASA treatment. Those that are high risk for transmitting to the above group should also consider being vaccinated. Those include healthcare workers, care providers, household contacts, newborn households. So if you're expecting a baby in this influenza season, everybody in the household should consider getting vaccinated. And then service providers that work in a closed setting. So for example, a ship crew that's working like on a cruise ship or other enclosed areas. So they have a risk of transmitting to other high-risk populations. Anyone providing essential community services, obviously to be able to maintain those services. So fire, police, our hydro workers, etc. And then last but not least, poultry industry workers. So this is really to help us avoid human avian gene reassortment. So we've all heard a lot about avian flu over the course of the last number of months. It's been there's been a number of outbreaks across the globe. This just helps reduce the risk that someone with human influenza potentially gets exposed to avian influenza, and then there's an opportunity for those to genetically kind of combine and make a new virus and have a co-infection. Next slide, please. One of the other things before we go on about COVID-19 vaccination is that it does not, the influenza vaccine does not offer protection against COVID-19. So the same risk factors really are important when you're looking at getting an influenza vaccine as getting COVID-19 vaccine. And for those over the age of 5, you can actually get your COVID-19 vaccine at the same time, or before or after an influenza vaccine. For those under the age of 5, the recommendation is to wait 14 days between the two. So either get the COVID and 14 days later get the flu, or vice versa. So as of Monday, September 26th, all individuals 18 and over, as well as immune compromised individuals aged 12 to 17, can now receive the new bivalent booster dose. And that's at a recommended interval of 6 months, or a minimum interval of 3 months since the last dose. So your last COVID dose, regardless of the number of doses that have been received. So this bivalent vaccine actually contains 2 of the mRNA components instead of 1. So this has the original strain of COVID as well as the Omicron strain, which has been the one that has been causing so many challenges for the last number of waves. And the COVID-19 vaccination recommendations for all age groups and where to access those vaccinations is available on the WeChew website at wechew.org. So there's still lots of places to get that across the community. It's never too late to get your first one. And certainly if you're due for a booster, it's a good time to get that too. And that is the end of my brief report tonight. Thank you, Mr. Chair.
Thanks, Karen. Do we have any questions or comments for Karen? So Karen, I'm going to throw you for a loop here, or Dr. Saad, just to be clear. So for those individuals in our community that do not want an mRNA vaccine, there are Johnson & Johnson vaccines available as well, correct? And those would be more towards your standard flu vaccines?
Sorry, Anthony, I don't know if it was directed at Karen or myself.
Whoever wants to answer it.
Yeah, that's true. So for those that are against mRNA vaccines, there are non-mRNA based vaccines. You mentioned one of them, Johnson & Johnson. The other one is Novavax, which is another non-mRNA based vaccine, which works on the same principle as the flu vaccine and other vaccines, where it's an antigen or a protein that's introduced into the body. Some of them are introduced through a virus, a viral vector, where it puts in DNA that then tells your body to make the RNA. So there are other options, although they're not so widely available. You still have to contact the health unit, and they would still have to acquire the vaccine itself.
Great. I'm just giving people options.
Yeah.
All right. Thank you, both of you. Appreciate it. So no other questions, comments. All right. Wonderful. Thanks, everybody. Next up, we have the Schulich report with Dr. Jacobs.
Thank you very much, Mr. Chair. Very brief report from me tonight. School year has gone off and started well with our students very happily back and starting up soon. Some year one and year two of integration experiences into the hospital setting, which we're quite excited about and very appreciative to all of the support from the hospital and helping them get settled in with all of their necessary PPE requirements and everything else. It really is a wonderful relationship that we have. And so I do want to formally thank you for that. Recognizing physician burnout is a big issue that we've been taking on at Schulich over the last couple of years through the pandemic. To that effect, we are hosting an event on October the 20th being led by two of our local physicians. So Drs. Dale Zeter and Jackie Vanderrieden are going to be presenting on October 20th at the school. It's a big event that the dean actually is going to be coming down from London for that as well, along with a few other of the senior faculty members to meet with some faculty, discuss ways that the school can try to help with these issues as well. There's an open invitation, which I've been sharing through my office, and hopefully we'll have a nice, safe turnout to try to rekindle some of the companionship I think that's necessary to help us keep going through some harder times. That event again is on the 20th, and then on the 21st we have some meetings that will be running through the day as well with various people that might be on this call, just to sort of keep that relationship nice and strong. But other than that, I mean, I think we've got a great start to the year. The students and residents are super excited and very happy with how things are going, and I don't have any sort of major updates or surprises. So that's all I have. Thank you.
Perfect. Thanks, Dr. Jacobs. Does anybody have any questions or comments for Dr. Jacobs? All right. Thanks. Next up, we have the financial presentation with Ian McLeod. Ian?
Oh, thank you, Mr. Chair. Mark, if we could share the screen, please. Thank you. Thank you. The next slide, please. This is the slide showing the financial results of the hospital for the 5 months ended August the 31st, 2022, as compared to budget. We have a $726,000 deficit from operations year to date, which is $1.7 million better than the budget. The net deficit after building amortization is $1.2 million, which is $2 million better than the budget. Next slide, please. This slide shows the breakdown of $10.4 million in COVID expenses. Unfunded COVID expenses total $1.3 million due to the wage differential to the nursing interns, expenses no longer funded via incremental expense reimbursement after June of 2022, sick and isolation costs and additional staffing in the program, incremental PPE, additional shuttle costs and storage. We do expect a $217,000 gap in medical remuneration to be funded. Revenue shortfalls in the three categories below are not funded. Volume-based, quality-based procedures, neuro, cardiac, and wait time. When compared to budget, there is a $4.7 million shortfall. The data is only available to May, so management has estimated the volumes for June to August so that we have numbers that are reasonably presentable. There will be a $1 million revenue loss in patient services revenue and a $351,000 revenue loss in recoveries. Next slide, please. This slide shows our year-to-date revenue. Base and one-time funding is $3.5 million favorable due to amounts that have been accrued for known COVID reimbursements. Preferred accommodation and co-payment revenue is $1.3 million unfavorable due to our inability to bill for private and semi-private rooms during this time at the interprovincial rate, which is higher than the OHIP rate. I'm sorry. Patient revenues is 2.1 million favorable, relates to uninsured patient revenue from the ministry. Other recoveries are favorable at around $1 million. Retail pharmacy revenues are offset by higher expenses. Final slide, please. Salaries and wages are $882,000 unfavorable to date. It must be noted that in the accruals are 1.6 million in COVID sick and isolation pay, and 2.4 million for nursing externs and 1 million in screening cost. We would be favorable to budget if these items were excluded. Medical surgical supplies are 349,000 unfavorable due to the increased use of PPE, which is not funded past June 30th of 2022. Medical staff fee variance is largely attributed to temporary COVID physician payments, which are funded at 2.1 million, with the remainder attributable to additional diagnostic volumes, which are funded via OHIP billings, patient services revenues. Drugs are 110,000 unfavorable. Additional drug expenses in retail pharmacies are offset by recoveries. Other supply variance of 762,000 comes from the following areas: legal fees, building and grounds maintenance, patient transport cost. In May, June, and July, the hospital is covering the patient cost transport to Hotel Dieu, nursing and retirement homes in order to free up beds at the hospital, and finish financial recruitment. That is a summary of the report, Mr. Chairman. I would take any questions at this time.
Thanks, Ian. Does anybody have any questions or comments for Ian? Seeing none at this time.
Mr. Chair, there's one final item. I will propose a motion that the financial report from the September 19th, 2022 Finance and Resources Committee meeting be accepted.
Wonderful. Seconded by David Mallion. Thank you, David. Questions or comments? Seeing none, all in favor? Perfect. Thank you so much. Next up, we have correspondence, printed material, media report is there for your information only. Board member questions. Does anybody have any questions? Nothing. I did forget to mention 3 other things I have written down here. So number one, there's a great fundraiser by the Windsor Cancer Center Foundation. It's called Protect Your Pumpkins. That is in relation to Breast Cancer Awareness Month. The shirts are selling fast, so please go to their website and check it out. I think to date, they've sold over 700 shirts, and it's a fabulous design. Next up, one of our great community partners, T2B, is holding the Spooky Windsor Essex. It's their T2B youth ambassadors, along with the Windsor Humane Society, would like to invite you to the Transition to Betterness 5th Annual Halloween Spooktacular on Sunday, October the 23rd at Malden Park. And last and certainly not least, I want to say a big thank you to Carol Parent for her fundraising efforts. This is the 3rd year that Sail Into Summer has been put on. And this year was their biggest event yet. They actually raised over $50,000 for the hospital and the purchase of a new endoscopic ultrasound machine. And overall, over the past 3 years, which we all know have been very challenging years, Carol's helped raise over $100,000 for the Windsor Regional Hospital Foundation. So on behalf of the board, Carol, thank you for everything you do. It is greatly appreciated. And the people of Windsor and Essex, thank you as well. So with that, the date of our next regular board meeting will be Thursday, November 3rd at 5 p.m. again via Zoom. Can I get a motion to adjourn? We have Genevieve Eshok, seconded by Paul Lachance. Thank you. I assume there's no questions. All in favor? Perfect. Thank you. We are going to give, I know David and the team are going to meet with the media now. We will, if board members and staff could come back on at 5:55 or so for the in-camera session. We'll be able to get going a little bit earlier, and hopefully one of our individuals needs to sign off early, so we'll try and get her work done as quickly as possible. I see the big smile on her face. So thanks, everybody. We'll see you in 10 minutes.